Welcome to the Genie Journal Recap, your monthly update on the regulatory, financial, and operational shifts shaping medical transportation. We track the headlines so you don't have to, and explain what they mean for providers, brokers, and healthcare stakeholders. Here is what mattered in March. This month, the major story is developing in Minnesota, and it has already gained the momentum to reverberate across the entire nation. According to Associated Press, late last month, Vice President J.D. Vance and CMS Administrator Mehmet Oz announced the temporary halt of nearly $260 million in Medicaid reimbursements to Minnesota, citing $243.8 million in unsupported or potentially fraudulent claims across 14 high-risk programs, NEMT among them. The funds would be released only after the state submits and acts on a corrective action plan. This move is part of a larger administration effort to spotlight fraud across the country, one that traces back to allegations of fraud involving daycare centers in Minneapolis. To understand why NEMT is at the center of this, as CBS News reports, the Minnesota House Fraud Prevention Panel heard testimony from DHS officials flagging the core problem. No easy way to verify a trip was actually provided or that a corresponding medical appointment existed. The program served 250,000 Minnesotans across roughly 2,000 providers in 2025 at a cost of $127 million. A provider enrollment moratorium is now in effect across Twin Cities metro counties, with unannounced site visits underway through May.
DHS data showed a 64% drop in billed rides, likely reflecting both bad actors going quiet and legitimate providers holding off on billing while the regulatory picture settles, since the one-year claims window gives them room to wait. Minnesota, however, is not accepting the withholding without a fight. They are pushing back. The state, which has 1.2 million Medicaid enrollees, called the move political and noted it had already been fighting a separate threat to withhold more than $2 billion in annual federal funding. As per PBS News, on March 3rd, Minnesota Attorney General Keith Ellison sued the administration to block the withholding of Medicaid funds, arguing the move violated due process and imposed retroactive conditions without proving the state's non-compliance through proper legal process. But the legal challenge is only one front. Alongside it, Minnesota is taking structural steps to address the fraud crisis. Governor Walz announced a proposal to replace the current patchwork of counties, MCOs, and state agencies with a single centralized administrative service organization handling Medicaid claims processing, provider services, and financial transactions, while shifting eligibility determinations from counties to the state. For NEMT operators, a centralized ASO, Administrative Services Only model, could mean standardized provider networks, billing rules, and rates statewide, simplifying credentialing across county lines. Additionally, on the legislative side, the Medical Assistance Protection (MAP) Act, introduced February 25th by AG Keith Ellison and bipartisan legislators, passed the Minnesota House Judiciary Committee on March 10th. The bill expands the Medicaid Fraud Control Unit from 32 to 50 staff, adding 11 investigators, 3 attorneys, and 4 support staff. This strengthens fraud statutes to cover a broader range of schemes, creates tiered criminal penalties for fraud exceeding $100,000 and $1 million, and extends the statute of limitations to the inception of each scheme. The federal government matches MFCU investment 3-to-1, making it one of the most efficient anti-fraud investments in state government.
What started in Minnesota is now a federal conversation, and here is where the story gets bigger. The outcome of this situation will impact not only Minnesota. CMS has sent fraud accounting letters to governors in California, New York, and Maine, and the House Energy and Commerce Committee expanded its investigation to 10 states: California, Colorado, Massachusetts, Maine, Nebraska, New York, Oregon, Pennsylvania, Vermont, and Washington. GPS verification and electronic trip documentation are moving from best practices to mandates. Providers already running compliant operations are positioned to absorb volume as the market consolidates around quality. We will continue to report on this developing situation, so subscribe not to miss the upcoming coverage. Let's keep rolling. The federal pressure is building up, and New York is working to get its own medical transportation in order. This action follows a federal audit that flagged up to $196 million in questionable NEMT payments out of $445 million reviewed, one of the largest state-level NEMT oversight findings in recent memory. New York currently has no unified system for managing NEMT authorization and payment across its counties, creating the kind of fragmentation that makes fraud difficult to detect and improper payments hard to recover. To change this, Senator George Borrello introduced S9398 on March 9th, a bill that would create a 2 to 5 county pilot to test a unified platform for NEMT authorization, coordination, monitoring, and payment over 2 to 3 years, with baseline fraud metrics established before launch. More consistent payments, cleaner trip verification, and a compliance standard that rewards operators already running tight operations. If the pilot works, expect other states to follow.
Stepping back from enforcement and into the market, there is a notable development on the technology side. Uber Health now lets riders book their own trips while a healthcare organization covers the cost. Early pilots show an 86% drop in cancellation and missed connection rates. The feature is aimed at ambulatory, low-acuity transport, the kind of trip that fills a fleet but doesn't require a credentialed driver or a lift-equipped van. The operators benefiting from this aren't the ones treating rideshare as a threat. They're the ones using dispatch platforms that can push a standard ambulatory run to Uber Health on demand, keeping their own vehicles free for wheelchair, stretcher, and compliance-grade transport. That's where the margins live, and where rideshare isn't equipped to compete. Beyond the fraud enforcement wave, there is a separate financial pressure building on the Medicare side. CMS's CY 2027 Advance Notice, released January 26th, proposed a net payment increase of just 0.09% for Medicare Advantage plans, a stark drop from the 5.06% increase plans received in 2026 and 3.7% in 2025. With flat funding at a time of rising medical costs and high care utilization, industry groups warned the proposal could result in benefit cuts and higher costs for the 35 million seniors enrolled in MA. The industry response was immediate. The Better Medicare Alliance submitted formal comments calling the proposal unsustainable, specifically citing cuts to transportation, meal delivery, and in-home support services, and more than 100 healthcare organizations joined a coalition letter making the same case. MA plans offering transportation benefits have already declined from 38% in 2022 to 24% in 2026, and further rate compression gives plans another reason to cut them entirely. The April 6th final notice will signal whether that trend continues or stabilizes.
While enforcement and rate pressure dominate the headlines, the broker landscape is shifting just as fast. HealthSpring, Cigna MA, transitioned its NEMT benefit from Modivcare to MTM Health effective March 1st. United Healthcare Community of Florida switched from Modivcare to MTM Health for NEMT effective March 1st, 2026, covering transportation to appointments, pharmacies, and hospitals. Providers and members transition seamlessly, with MTM handling all covered services. Broker transitions create real volume risk for those who don't and real opportunity for those who do, so move fast on credentialing. On a more constructive note, there is an open window right now that providers in rural markets should not ignore. DOT opens Rural Transportation Input Window, and you should weigh in. The U.S. Department of Transportation's Routes initiative published a request for information on February 23rd, seeking public input on unmet rural transportation needs and barriers to accessing federal funding. The comment window is open 60 days. Rural and frontier markets are where NEMT coverage gaps are most acute, making this a direct opportunity for providers to put their operational realities on the record. Comments can be submitted at regulations.gov under docket DOT-OST-2026-0298. Providers who have navigated funding barriers for rural transportation have a particularly strong case to make. DOT has said this input will shape future grant program design, meaning providers who engage now can influence how rural transportation funding gets structured.
Finally, we are back inside the lamp. This month, we are happy to announce that a case study featuring Ride Your Way is live on our website. They grew from a single vehicle and an Apple Calendar to 36 vehicles, 1 million miles, and Michigan's only NEMT-accredited NEMT provider. Ride Your Way's growth story covers how they scaled their fleet, cut hospital discharge wait times from 4 to 8 hours to on demand, and built the data credibility to win and keep major healthcare partners. On the product side, our team modernized the invoice layout across all pages, along with expanded detail visibility. And for broker connectivity, we have also integrated with Federated, known as FTSB. If you work with this broker, contact our team today and we'll help you get connected. And one more thing, we have a new video up on our channel. If you are shopping for new vehicles for your medical transportation fleet, check out our updated guide. It covers every major vehicle class with real 2026 pricing, used market ranges, and the specs that matter for operators. This is it for this month's Genie Journal Recap. Minnesota is the story to watch, and we will keep following it. For deeper analysis and source links, check out the description. If you found this useful, give us a like and subscribe so you don't miss the upcoming recaps. See you next month.